Thank you so much for your time, Helen. It's awesome to have you with us. Can you outline for us what is the kaupapa of the Global Commission, and tell us a little bit about what success would look like from your perspective?
Well, good morning, everybody. Kia ora. Thank you for the welcome. And your photo brought back memories of all those bottles of Marmite and packets of ginger nuts and Vogel's bread, which people used to bring when they came to see me in New York. So good memories of that. But yes, one of the sort of many interests I'm pursuing, now I have a little free time in my hands. It's all gone, by the way, because I tend to agree to do too many things, but is this Global Commission on Drug Policy. So what is it? Not a UN commission, actually. It's an advocacy group of former leaders, former heads of state, former heads of government like me. Kofi Annan is on it. It actually followed a commission that was set up by some Latin American presidents, which sort of melded into it. And it was a Latin American commission on drugs and democracy. Interesting combination. Because what a number of the Latin countries saw was how the war on drugs and how it raised the criminalisation of drug issues in their societies actually ended up being very corrosive of the rule of law, of democracy, big money spoke, and so on. And I recall about 6 years ago going to Bogota in Colombia, and the President Santos, saying to me, Helen, we have paid an incredibly heavy price for the war on drugs here. And I'm sure any Mexican president would say exactly the same to us, let alone El Salvador, Honduras, Guatemala, others really terribly affected by this, quote, war on drugs. So the Commission reformed as a global commission in 2011, and the aim was to advocate for evidence-based drug policies. Now, they can be a bit counterintuitive, largely because we have a drug perception problem. And that is what the report that was released in January, which I went to London for the release of, was about. It said the whole debate about drugs is framed in moralistic terms about good and evil, etc. And you can't get rational debate once something is reduced to that. So it's really to bring the evidence into the argument, and to look, for example, at the fact that the current classification of drugs globally, let alone our own little country, bears no relevance whatsoever to the level of danger of drugs. And just to refresh memories, and you're a very informed audience, but levels of problematic use of drugs, for cannabis is put at 9%, alcohol at 15%, heroin at 23%, and tobacco at 32%. In other words, the most problematic, dangerous use is tobacco, which we have as a legal drug, and we endeavour to regulate. And I've done a lot of the hard yards on that one as well. So in essence, it's about putting the facts on the table, looking at what the evidence is, and then supporting societies to find their own answers, because there's a range of answers and a range of contexts. What Portugal does, which looks pretty good to me, is not what Switzerland does, but Switzerland also gets considerable results. And we're seeing quite a lot of countries innovate in drug policy now.
Yes, it's that innovation, isn't it, that will actually help develop some of the evidence that you're seeking. So, Helen, tell us about how your perceptions and your views of drug policy and treatment may have changed over the years, and what may have been some of the key influences of that.
Well, my private view for many, many years, and I have been a Minister of Health in David's shoes about close to 30 years ago, my private view has always been that it should be dealt with as a health, social and well-being issue. But in politics you've only got so much bandwidth, and I think I've been known for taking on a lot of pretty tough issues in my time, probably to the extent of almost exceeding bandwidth. The biggest issue I took on as Minister of Health was tobacco. with that first smoke-free environments legislation, banning advertising and sponsorship. It was tough. So a lot of tough issues. But I came to think a bit more about drug policy, mainly through the lens of the response to HIV. Now, of course, people who use intravenous drugs are a key population, almost anywhere in the world, for risk of HIV infection. And even before I became Minister of Health in 1989, Michael Bassett, as Minister of Health, had done good things. You know, the needle exchange scheme was set up, which is a key thing in harm reduction. We also had a very good outreach to sex workers, and we had full engagement of the men having sex with men community. Now, interesting that in the law responses on HIV, we in 84-85 had the debate and then decriminalised male homosexuality. Very, very important step. When I was Prime Minister, we decriminalised sex work. But it's interesting, isn't it, that of the three key populations affected, the toughest one to get the law response on has been on people who use drugs. And now, you know, I'm not in office now, I don't have the power to, you know, bring legislation to Parliament, but I do have the power of voice. And in my opinion, we should be decriminalising use and possession, because I think that we are driving our prison population up with these bad policies. It's not doing anyone any good. What good does it do to put a person using drugs in jail? None whatsoever. So I really think we need a fresh look, but we need a fresh look that is going to engage people with open minds across political parties. If it becomes a Labour, National, Green, New Zealand First, whatever issue, you've lost it. It has to be based on a rational debate that says, what are we trying to achieve here, folks? Everyone's worried about the prison population. Well, you know, some sensible drug policy could be a contribution to doing something about it. So that's where I'm coming from now, and very much basing what I'm saying on what my understanding is of the work of the Global Commission that I've joined.
And I would just reiterate, and you mentioned about the needle exchange particularly, that New Zealand was a world leader in regards to publicly funded needle exchange in the day. And, you know, really proud to say 30 years this year, is it? I think, yes. That was a huge step forward, and it actually, I think, went a huge way to almost eliminating HIV in the IDU community at the time. And so we have shown in the past that we can innovate courageously and do it effectively. So I think, you know, we've done it once, we can do it again. We do actually have, as many of you, hopefully all of you, know, a health-focused drug policy, and we've had one since 2016. But the funding to support that drug policy is still heavily weighted by a factor of 80 to 20 in favour of criminal justice responses to drug use. And just yesterday I was informed, because a service has picked up work within corrections, that the prison population at Mount Eden, 25% of whom are of Asian ethnicity, almost all for drug-related offences. So we're talking big numbers are still being tracked through the criminal justice system. I guess what's interesting to me is that it seems whenever we talk to people, they readily accept that the drug problem should be seen through a health lens. But when it comes to actually doing something about it, there is a tendency, although they might understand the war on drugs has failed, to still revert and support increasing resources that actually keep those policies sustained and keep them going. So I'm curious about what you might think are some strategies, or what that might, because it's not unique to New Zealand that happens. But I'm wondering about what your thoughts are around that.
Well, it's not unique to New Zealand because New Zealand, like a lot of countries, has, if you like, followed the war on drugs approach. And it's interesting to me, having spent most of the past 8 years in New York, that the UN conventions in this area are distinctly unhelpful. Usually we look to UN conventions to set a good standard for society. Convention on the elimination of discrimination against women, rights of the child, convention on the rights of people with disability, but these drug conventions are not helpful. And increasingly this is the subject of more critical debate at the high level events that are held on drug issues. So we, of course, are not bound to follow a war on drugs approach. We could take the Portugal approach. And what was the Portugal approach? Well, again, you're an informed audience, so many of you may know, but when the person who is now Secretary General of the UN was Prime Minister of Portugal, Mr. Guterres, his country had the highest rate of drug-induced death in Western Europe. And they said, we can't put up with this. It's not good to have people dying unnecessarily because they are using drugs. So let's see what we can do about it. They decriminalised, as well they put a whole raft of health and social and other measures around it. Today they have the lowest rate of drug-induced death in Western Europe. The highest rates of death tend to come in the countries with the most repressive policies. For example, the United States and Russia. They may not have a lot of common on many things, but they do on this. And heaven forbid, we're now hearing about the possibility of the death penalty in the United States. What good is this going to do? To really look at the whole social and economic context around this, I do recommend an incredible HBO documentary I just saw on Qantas last week called Meth Storm. And it's what's called a cinema verite, fly-on-the-wall documentary that goes into rural Arkansas and looks at the issue of methamphetamine through the eyes of the families that are caught up with it and the police that are going out there doing their job as instructed. And what comes through this all the time is these communities are poor, they're jobless, they lack services, they lack hope, and they're in, just a cycle that goes round and round and round. They're picked up for use, they're picked up for small dealing because they're trying to pay the rent. The police know it's not going anywhere. The families are just further ground down. And, looking at it, I thought, a version of that film could be made in our country or many countries. So, I was so pleased to hear Minister David Clark talk about looking at the social determinants. What are the social determinants around these issues? If we leave people to languish for years in conditions of poverty, high unemployment, lack of hope, what do we expect? Many things are the consequences of that. So I think our approaches, we're spending all the money at the moment on the jails, right? But our approaches need to go back to what is it that will build a decent society and communities. Then what can be done around prevention, because I don't advocate use of drugs, by the way. What can be done about prevention, and then what can be done with all the harm reduction measures. And there are many, and everywhere they're put in place, they work. Take, for example, the case of Switzerland, where Zurich was known for having the park with spaced out people in difficult circumstances in all weathers who were using drugs. The woman who is now the chair of the Global Commission on Drugs, Ruth Dreyfus, was Health Minister of Switzerland at the time, and she introduced the harm reduction measures which got people out of the park into safe injecting spaces, able to have their drugs tested, health and other social services, and if they wish to come forward, to go into the substitution therapies which could help them get their lives on a better track if that was what they wished. Very much a human rights-based approach. So there's just so many things you could invest in that would make a difference, and frankly, probably cost a fraction of what we're spending jailing people for use and possession.
I think we would agree. And just to echo that, we're going to be hearing after morning tea from a number of folks who in the course of their work encounter exactly that scenario and have an opportunity to talk from that community level response about what is it that they're seeing, before people actually enter treatment or services, because there's some critical gap there that we need to be really mindful of. You've started to talk, Helen, about some of the initiatives and some of the different ways of perceiving how we could engage at the community level to address drug use. I'm wondering about some of the key critical success factors of effective responses to drug use in our communities, over and above those community responses. What do you think are the things that need to be put in place for those things to occur?
Well, I mean, addressing the whole socioeconomic context is clearly fundamental, and it's not done with one swing of the wheel, but believe me, having been a PM for 9 years and, with a range of policies driving unemployment down pretty decisively, I know you can do that. I know you can restore hope to communities. I know you can get people out of, long-term, very degrading and difficult circumstances and back onto, standing on their own feet and feeling that there's hope in life. So there's that broader picture. But then I think it's really about having been away for the best part of 9 years, I may get terminology wrong, but if the money is supposed to go out through the area health boards, for example, for services, let's get it out. Let's get it out to the community level. Let's get it out to the organisations that are closest to those who are using drugs. And let's really, learn and borrow from what works well. I mentioned drug testing before, and I understand there are initiatives in New Zealand around the big music festivals, for example, where people could have drug tested. But what about, more use of safe spaces for injecting drug users, if indeed they exist? Maybe some do, maybe they don't. Here they do in some countries, but that is also a place where people can have what they're using tested. The key motivation for me is people shouldn't be dying, right? People should not be dying. People should be able to live a life to its full extent and potential. And so there's a lot of things we could do, but I would strongly advocate doing it through the community-based organisations that are closest to the society, understand the people, and support them. And as I say, a fraction of what we're currently spending locking people up would make a huge difference to so many of those services.
Certainly, they're all preventable deaths.
All preventable deaths.
And that brings me to the next question, and that's in relation to the advent of what we've called new psychoactive substances, and I know that's been a lot of cause of discussion around the UN table in terms of managing, the daily occurrence of new substances. And in fact, here it has not only spurned a number of headlines and attention in the media, negative attention in the media, which has garnered communities to try and solve the problem. It has also unfortunately led to a number of deaths, considerable number of deaths. And yet, despite this, we have really struggled to implement, as you mentioned, drug testing in events, major events, which potentially could save lives. And also an early warning system, which we feel strongly could also impact the level of safety for people as well. So what, in your experience, are the key barriers to implementing measures that potentially can save lives? And what do you see as are there some jurisdictions that actually do this successfully?
Yeah. Well, I think one of the main barriers is the fact that the activity of possession and use is deemed to be criminal, because that almost frames the issue, doesn't it? It says, well, that's criminal, therefore if you're doing it, you're criminal, therefore you're a bad person, therefore you should be locked up. I mean, it's not a kind of logic that leads you to the kinds of things we're talking about. Now, having said that, Switzerland did find a way where they didn't decriminalise, but they opened up space for harm reduction, presumably on the no questions asked basis. And one assumes that our needle exchange scheme is on a no questions asked basis. Don't ask, don't say, as Bill Clinton once famously had a policy in the US military. So that could be one way forward. Now, of interest, I think, is some of the debate going on in the United Kingdom, because they have a legal framework rather like ours, and now quite a worrying rate of deaths as well. And former Deputy Prime Minister and leader of the Liberal Democrats, Nick Clegg, is a very powerful advocate on this subject, and I listened to him at great length in January. So what you're seeing there is at the local level, where you have these now, I think, police and crime commissioners who are elected officials, these people are starting to say, we need the space to do some of these things. Okay, we know that down in London at the Home Office with a minister, we're not going to get anywhere anytime soon. But we're going to use the powers that we have as leaders of police and law and order, etc., in our community, to make it possible for people to have safe injecting spaces and their drugs tested, and. So, I wonder if, to what extent, police in our own country, who are close to the community, right? We are very lucky to have community-based policing. Whether, there can be some more leeway for them to help open up the space, because that's the way it will happen in the United Kingdom in the first instance. And certainly in Switzerland, without decriminalisation, you don't have police swooping on drug testing and swooping on safe injecting spaces and so on, because everyone realises there's a bit of give and take here if you're going to save people's lives.
Yeah. And I think too, it's also about how we talk about the issue and the language that we use. Matua Raki has had a campaign over the last year or so around language matters to try and change some of the way that we talk in the community about people who use substances. And also a big shout out to my colleague Kiri Opai, who has done an amazing piece of work, Te Reo Hapai, which is the language of enrichment, which starts to build some words in te reo, which we have never had before, that help reposition our language that we use to describe people experiencing emotional distress and people experiencing issues with drug use. And particularly, we've never had a confirmed word for addiction before in te reo, so now we have ngā piringawara, I hope I got that right, which is really about the connection with the substance, and that speaks much more about the relation for the person, about what's going on for them. How do you see language? Because I know it's one of the things that the Commission is actually very keen to promote. So, Helen, how do you see language impacting the way that drug use and people who use drugs are perceived, and the impact that this has on the support for treatment in terms of resourcing, etc.?
Well, the whole last report of the Commission released in January was about this world drug perception problem, and it looks at the issues of language and how people who use drugs are often dehumanised, depersonalised, easily kind of leading to being described as evil. And the Commission makes quite a lot of suggestions about what language to use. They definitely advocate talking about people who use drugs rather than using terms like addicts or drug users, or we tend to use shortcuts that aren't that helpful. But definitely, trying to get this moralising out of the language and see people who are using drugs as fellow human beings like us, also acknowledging, whether people will like it or not, that down through the ages, people have always sought the relief of some substance or other to give them some kind of vaguely out-of-body experience. This is reality. What is kava? What is X? What is Y? There's always been things that people have used. So let's work with the reality of it. Just saying, don't do this, never works, particularly with young people. But having a policy environment that is supportive in socioeconomic terms, where there's help when people reach out for it, where there's options to being put in a very dangerous situation to one's health and safety. This is where we need to aim to be. And come back to your opening comments about New Zealand being an innovator. We've been an innovator in so many things, where we've been able to have rational debates. Could we have a rational and evidence-based debate about this?
Yes.
Yes, we can.
Yes, we can.
Quite a certain guest to the country at the moment.
That's right. Yeah, absolutely. And I think it is, for us too, it's also about reminding us that it's about people first, people with issues. And it doesn't define a person. It is maybe something that's going on for them at that particular time, or it may be a part, but it's never the whole. And I think it's always helpful for us to remind ourselves that that's, because when we're encountering people over and over again, it's very easy to get locked into that sense of sameness and not see the person. So it is about identifying the person. And I noticed actually there was an interview yesterday that I heard around violence, and they were talking about people who use violence. So in the same way that we have tried to change language, it's also happening in other areas as well to achieve the same outcomes. So I think how we talk reflects how we think about things, and then how we actually articulate what we do about that. So it can have a huge impact, and we can all play a part in making that change. So kia ora, thank you so much for your time. It's been wonderful to have a chance to talk with you. I'm hoping you're staying a little while so we can update the selfies and everything, because there'll be a queue. But thank you so much. Please warmly thank Helen for her time with us this morning.